Hello, good afternoon, everyone. Welcome to another yet amazing episode of the Real Talk Show. Today, we are going to be discussing how accessible is self abortion to young people. So, before we dive deep into the conversation, I'll allow our guests to join the show to introduce themselves. We'll start with Victoria.
Good afternoon, everyone. Thank you, Linda. My name is Natasha Victoria Nakanika. I'm an SRH advocate from the Youth Platform. Thank you.
Hello, good afternoon. Thank you for joining us today. My name is Anna Muyambo. I'm a registered nurse midwife. I'm also trained in providing comprehensive abortion care services and post-abortal care services. I work for PPAZ.
Good afternoon, everyone. My name is George Mkwita. I'm a project officer from TYP.
All right, so before we dive deep into the conversation, we're gonna hear some feedback from the community and the young people what they think about abortion in general, and abortion care too.
On today's episode, we are diving in the areas of abortions, whether safe or unsafe. So today we are moving along our medical students to ask them what they think about abortions that are taking place in our country right now. So come along with me to Levi Manasa Medical University and ask our students what they think about abortions.
Mwe bantu, abortion tekintu ekisoma sana. In a personally, I think that act should be abolished because that's losing a life that's worth a lot. Tawishibe oli omuntu leipaya, maybe it's a sabali minipira when family. Maybe it's a such injefint kuntanshi number losing that life before it's even introduced to the world. That's really sad, and I think the government should work on that.
In as much as abortions have been made legal in a lot of countries, and that includes in taking alternatives as self-abortion, we want to anticipate or to consider abortion as a diverse topic, which may be considered as something that is complex, but due to the innovations that have been brought about, like safe abortions, we have things like women's health autonomy being upgraded, where a woman is asked to choose whether she wants to keep a child or not, and when she decides to abort, safe abortion is there to give them assurance of the fact that everything is going to be okay. Yeah, they will be okay at the end of the day.
What's your view on abortions in Zambia?
Well, I'm going to follow the law against abortion in Zambia. Is that legal abortions are not allowed, but the ones that are medically allowed, like you go to the clinic, those are okay.
I'm Christian, so the Bible says it's against abortions generally. So obviously I wouldn't support it.
So basically, I feel abortion isn't the right way to go. It isn't the right decision to take, considering the fact that it involves death, and not just for the child, but for the person that's carrying the child.
Ethically, abortion isn't really like a good thing. You know, like most people have views on it and say it's a right in an extent where you do it because you're not ready for the child, but then the repercussions of doing it itself are most of the time greater than the actual result. You say.
So we've heard from the young people, and everyone keeps talking about abortion. So before we go any further, Victoria, could you define what abortion is for us?
Thank you so much, Linda. In my understanding of what an abortion is, it is a medical or surgical removal or termination of a pregnancy, or in other words, I can say abortion is the termination of pregnancy before the viability. So this can be done surgically or medically, but in other contexts where we like people should not mix the point of the abortion or miscarriage, because abortion you have to intentionally remove the terminate a pregnancy, while a miscarriage, it happens on its own and due to other factors that may lead to the removal of the pregnancy. Thanks.
Okay, so you could equally tell us what are the types of abortion?
Okay, thank you so much. So, like I mentioned, say like there's medical and surgical type of abortion, but in other terms we have safe and unsafe abortion. So so when it comes to medical abortion, this is where a person takes pills to remove or terminate the pregnancy, and then when it comes to surgical, the person has to undergo a surgical procedure in which they have to remove the pregnancy. This can be dilation and curated, or dilation and evacuation, where they have to use vacuums to extract the pregnancy.
Okay, so we have heard what abortion is, what type of abortion there is. Now let's dive into it and talk about who is eligible to get an abortion according to the Zambian laws. Anna.
Okay, thank you, Linda. So, when it comes to accessing abortion services, anybody can access that service. There are no limitations. They won't chase you if you go to a hospital and request for an abortion. So if you are 18 years and below, or 18 years and below, yes, you can come for an abortion, but you need to come with a guardian to sign the consent form. So when it comes to an abortion, a consent form has to be signed. So like this is a document that is going to help both the practitioner and the person receiving the service in case of anything. So like for instance, medical termination. Medical termination, we give pills which can be taken at home. So maybe in cases where somebody is found with those pills and then maybe they're accused of doing it illegally, we can just show that as proof to say, no, this person came to access that service. So if you're 18 years and above, you can just come through and request for the service. Nobody is going to chase you away regardless of the reason why you want to terminate. So all you have to do is just sign a consent form, and the pregnancy strictly has to be below 24 weeks, 24, 28 weeks. Because at that point, it's actually 24, because at that point, we consider that fetus to be viable. So below that, after 24 weeks, termination can't be done.
Okay, thank you very much, Anna, for that insight. So we're going to move on and talk about what comprehensive abortion care is, because we have to be very precise when we talk about abortion. Everyone has heard about abortion, but then now we are here to dive deep in and talk about comprehensive abortion care. Victoria, could you assist us with the definition of comprehensive abortion care?
All right, thank you so much. I like the point that Anna had mentioned, to say that when it comes to like who can access abortion, she's given a good coverage on who can access and the age. So when it comes to comprehensive abortion care, in my understanding, this is a type of care that is given to a person that wants to undergo an abortion. So these are like medical services and support aimed at ensuring safe, accessible, and equitable abortion procedure. So this includes the pre-abortion counseling, the abortion procedure, and the post-abortion care and support that is given to a person. So this is the whole package in which a person is supposed to undergo while they want to have an abortion. They have to be counseled, like Anna had mentioned, to say you have to go and get the consent form, so that because there are charges that are attached when they find you are like you conduct an abortion, an illegal abortion, because as we all know that abortion is legal in Zambia under the Pregnancy Act 304 of the laws of Zambia 1994. So the comprehensive abortion care is the whole package that comes from counseling. When you go to the facility, you're counseled. They have to know the reasons why you want to undergo an abortion. Then they have to now the stage for conducting an abortion, because there are certain procedures that are supposed to be done. And then the post-abortion care, where you have you're bleeding. They have to make sure that you do not lose excessive blood flow and whatnot. So it's a whole package, as well as the post-abortion care after the abortion. If you want to undergo another type of counseling abortion, it is like the whole package, in my understanding. Thank you so much.
All right, thank you so much. So from our online audience, we have a question specifically directed to Anna. So Bundani Zdambo says, Anna, most of the adolescents whose pregnancies are above 12 weeks are being sent back as it has gone beyond prescribed weeks of pregnancy. Please kindly clarify that, please.
Okay, so when it comes to abortions, despite abortions being legalized in Zambia, there are still people who want to try to convince clients who come for that service to say, no, you can't keep this child. This child is already above 12 weeks. But that's not supposed to be the case. Because one thing I can tell you is unsafe abortions actually contribute to the maternal deaths that are recorded every year. So those who are sent back, it's actually unfortunate. So for me, because of our clinic setup, I only conduct abortions that are 12 weeks and below. So 12 weeks and below, I have to refer them to hospitals. So when it's 12 weeks and below, the procedure is a bit different. It's more involving, and you have to be admitted, because they'll probably have to give you maybe more doses since the pregnancy is bigger. So for me, what I do, if a client comes and the pregnancy is above 12 weeks, but below 24 weeks, I find, because we have clinics. So PPAZ has clinics in Kitwe, Lusaka, Choma, and Livingstone. So what we do is we have associated clinics that we work with hospitals. So if I can't conduct it, I'll probably give the client options. We can go to this hospital, that hospital, and make sure I link them to somebody so that at least they are comfortable to go to that facility, rather than they reach, then they start asking, because young people are not really that free to ask openly about the service. So that's what we do. So it's quite unfortunate that they are sent away, but 12 weeks, we still do. As long as it's before 24 weeks, an abortion can be conducted.
All right, thank you so much. Just what was you on that? Where can AYP access comprehensive abortion care services away from the PPSZ clinics? Is it just specifically for there, or there are other facilities where young people can go and access the services?
So young people can actually go anywhere, but it's just, again, it comes back to us health workers, sometimes our attitudes towards young people when they come for that service. So simply because I am not comfortable or I am that mother figure, some people wouldn't want to entertain that. So apart from PPAZ, the other organization that offers this service is Marriage Stops. So Marriage Stops, they also have clinics, I think, in Lusaka, Copperbelt as well. So any hospital can offer the service.
Okay, can I just add on to what Anna has mentioned? I
Yeah,
like the
go
fact that
ahead.
she's given specific facilities that AYP can go and access services, but I also know of any like government facilities, like it is legal for you to walk into a government facility, and AYP are encouraged if they want to conduct an abortion, they can just go to any government facility and ask where they can conduct an abortion from there. I know that it's free, and any government facility that is near your area of residence, you can walk in. But as Anna has mentioned, to say there are other healthcare providers that are mother figures, that are preachers. When you go there, they start preaching, and instead of giving you options, and then yeah.
Thank you so much. So while we're still on that, so we have heard about the types of abortion and every detail, but then we still have a lot of cases of unsafe abortions, and we still have high increased maternal mortality due to unsafe abortions. So, Mr. Mukita, could you simply highlight what your thought is on some of the barriers that AYP face in accessing safe abortion?
Thank you, Linda. Thank you for that question. I think the first things first is with AYP, most of them, because activities, I would say activities are done in the dark. So before the parents are aware of what has happened, you'd find that they would want to terminate the pregnancy as soon as possible. And if they do go to the clinic, as Natasha was saying earlier, you would find that there are people who are mother figures who want to talk to a child or a young person to say, but why are you doing this? Why are you involving in, why are you involved in this sexual activity? So you'd find they would shun away from the safer abortion options that are available. They would listen mostly to their friends. Say, no, don't even go there. I know a solution. And it's even quick. Nobody would know. So it's not only young people, it's also parents. Sometimes, well, as we all know, in certain communities, abortion is still an embarrassment to parents, so to say. If they discover that their child is pregnant, they would want to terminate that as soon as possible, so that they are not a laughingstock of the community. So you'd find even parents will not go to the clinics for safer abortion options. They would also opt to not to dent a bad name on certain community ladies, not to say alangizi, but certain women that will show them to say, okay, this is the other option, and and you'd find that in the long run, the complications that come about. So, in my view, I feel it is the fear of embarrassment as well as the fear of parents finding out. Those could be one of the barriers that young people face, especially in accessing safe abortion.
All right, Natasha, what's your opinion on the matter of what barriers are still there that stop AYP from accessing these services?
Okay, thank you so much, Linda. I would draw on what Anna had mentioned earlier, as well as what George has just alluded to. So when it comes to like barriers, there are a lot of barriers. Starting like yesterday, I was just reading some of the comments that were being shared on the earlier post under the the same post for today's topic. There are a lot of people that were talking about because there's stigma attached to abortion, as well as it, as well as corruption. So when you go to health facilities, you find that the healthcare providers that are supposed to provide the service for free are busy selling the uh, abortion drugs, as well as lack of access to safe and affordable, timely the abortion care. You find that people just go to the facility, they don't know, like the earlier comment to say people are being told to go back because the pregnancy, they will tell them, no, the pregnancy is has grown, you cannot conduct an abortion, because, maybe because the person that you found has got lack of enough information to give to that AGYW that has gone to access the service, as well as the issue of probably consent, the consent that is needed. So, like George had mentioned, to say when the young person goes to the facility, they're told, no, you need to come with a guardian so that we're able to conduct this abortion, and then this person had unsafe unprotected sex, and then they ended up becoming pregnant, so they didn't want the parent to know in the first place. So now going back to the facility with the parent is kind of, there's that feeling to say my parents are going to find out and whatnot. So I think there are a lot of barriers, but most of these are like the major ones: stigma, as well as the corruption, where you go to the facility and you find out that the the healthcare providers are selling these abortion pills and whatnot. Yeah.
Maybe to add on as well on what Natasha is saying is, in most cases, it is the misinformation that is within the community. I believe also to some extent, certain young people do not have the correct information. They lack that information. So whatever information they get from their friends on what was done and how it was done, to them, that's the correct information. And also, a lot of people do not know that government facilities, as well as other NGOs, do offer safe abortion options for free. Those services are actually free. So most of them think, nikankana na mimba pa, kuzafunika maybe this amount or that amount. So some of them end up now using those options that we talked about. So the information also is not there in the communities.
Yes, I would also like to add on that point.
Okay.
Yes, so lack of information. So it's like a lot of young people do not have information on, let me just say generally, reproductive health, because of our traditional beliefs where parents, guardians do not want to talk about certain things. So they really don't know much. And that's why, because they don't have that information, they now turn to their friends who will lead them to the most, I think, the easiest way out. So that's why you find that they opt to go for something that they can just easily use to get rid of that pregnancy. So yeah, that's my contribution.
All right, thank you so much. So we take it to our audience now. Namia Bahimamba says, abortion is also conducted when there is substantial risk that is, if the child were to be born, it would suffer from mental or physical disabilities. Enoch Kalibwe, I hope I got that right, says, can abortion result to ostrich fistula? And if so, what are the remedial measures that should be taken? Anna, could you answer that for us?
Okay. In cases of safe abortion, I think there are minimal risks or complications. It's very rare. So when we're doing the surgical procedure, when we're doing the dilation, we always make sure that we're careful, but Fistula, no. I highly doubt, no. It doesn't result
All
to
right.
that.
Thank you so much. So, in as much as there are so many barriers that hinder AYP from accessing abortion services that are safe, there are also some traditional beliefs that may be attached to why AYP do not access these comprehensive abortion care services. So, what do you think are some of the traditional beliefs that surround abortion? I'll start with Victoria, and we'll go to Anna, and we'll go to Mr. Mkwita.
Thank you, Linda. So some of the traditional beliefs that surround abortion that I've heard is that when somebody has aborted, they are sinners, they are cursed, they need to be cleansed so that they are able to, they are able to be cleansed. And then other traditional beliefs is that like when a person aborts and greets or starts talking to the other people that are, you know, normal people that have not undergone an abortion, they are going to make them have, or they'll have an illness that needs to be cleansed and whatnot. So there are many other, like there are many factors or many beliefs that surround abortion. And then um there's a I wanted to talk about, because there's safe and unsafe abortion, right? So we've drilled much on like safe abortion. We've spoken about where this person can access and where the other person, where what are the achievements from that, and then we haven't like drilled much on like the unsafe abortion, where we know that this is a type of abortion that is done away from the facility, and then it's done with like it's done like when I'm a young person, I just find out that I have I'm pregnant. I go and seek traditional herbs, or I don't know, some other uh, cassava leaves, the ones that they use. Because I read in the comments yesterday that some people use cassava leaves to prick the uterus and whatnot. So once that is done, probably that's where people find out that people have died, and then now they are using those myths and misconception and also putting it part, like taking it to say, you've seen like the traditional belief to say this person had an abortion, and then now they like, you've seen what happened to them, because it has like infection and whatnot, so the person gets sick, so they use that and start telling people to say, no, when you undergo an abortion, you probably get sick, you probably have an illness and whatnot, and then you need to be cleansed, because after an abortion you need to be cleansed, like that's the procedure, you need to be cleaned in the womb and whatnot. But due to that, people now take it to be like a traditional belief. They're trying to scare people, and so that young people should not undergo the safe abortion. I think that's what I have to add.
All right, Anna.
Okay, so I think when it comes to traditional beliefs, when it comes to abortions, I think Victoria has mentioned most of the important points. So traditionally, it's just not acceptable to have an abortion because of that stigma it comes with. So I'd just like to add on something that is also part of the comprehensive abortion care and post-abortal care. So during counseling, we also encourage especially young people who have no intentions of having children anytime soon, to also consider contraceptives. Because when someone, if an abortion is done today, after the bleeding is done, and if they have unprotected intercourse, there are high chances of them getting pregnant. So we always emphasize and encourage young people to be on contraceptives. So while we're doing the counseling, we try to find out what type of information they also have on contraceptives, because there are also a lot of misconceptions about contraceptives in the community, where people say, no, if you've never had a child before, or you're not married, you can't use contraceptives because in future you won't be able to have kids. So we also counsel them in that area so that they also understand that contraceptives, if they know they're sexually active, it's best they're on a long-term contraceptive, which will help them not have another pregnancy. So as these people come to us for information about abortions and all that, we also just have to make sure we also include that part, because I've had an encounter with clients who've had, like, maybe in 6 months they've had 2 or 3 abortions. So let's just encourage them on that part as well, and just clear any misconceptions that they have about contraceptives.
Okay, thank you so much. Mr. Mkwita, do you have anything to add on to your question?
Yeah, perhaps, thank you, Linda. I should also add to say all these misconceptions about abortions, the myth, the beliefs, is because of the bad practice of unsafe abortion. So as a result of what is coming off that bad practice of unsafe abortion, they are taking it as this is the actual the truth of what happens, not knowing that it's because of the unsafe practices that are being done. They are the causes of what is coming after. So I think I sympathize with healthcare providers, because it seems like the communities are misled within the communities themselves. And I think it is important as healthcare providers as well as NGOs, we get into these communities, provide the correct and right information, so that we don't lose a lot of people due to misinformation, because people do not have access to the correct information. Henceforth, you'd find whatever is gospel truth in the communities, they will take it up. And I know also, I've heard of communities complain about, well, just moving away, just to give a bad example, communities will move away to say, no, I went to the hospital today, they gave me Panadol. You know, so they want to cure themselves, they want to diagnose and cure themselves, society. So I think it is up to us, we need to take up the responsibility to go into these communities, try to save as many lives as possible, to give them the correct and right information regarding unsafe and safe abortions, and the access to safe abortions for young people especially.
Okay, thank you so much, Mr. Mkwita. We've got comments. So Kim Sen says more information should be spread in our communities, especially in the rural areas. Adolescents are lacking that. Okay. Budani says the unsafe abortions are due to lack of services, especially in the rural areas like Namuswa and Old Kachenji, I hope I got that right, where such services or information is not provided. Vincent says, I believe a lot of adolescents have no knowledge about safe abortion. And Teresa says, I feel the community must be educated about safe abortion and contraception. Which brings us down to our last topic of discussion before we close. What Natasha highlighted unsafe abortions. So before we come to the end of our show, I would like if we would take some time to discuss what are some of the consequences of unsafe abortions. I think we can start with Anna.
Okay, thank you, Linda. So, unsafe abortions have some consequences that are actually permanent. So, when someone attempts to conduct an abortion on their own, they will succeed, and sometimes they'll find that they have what? Retained products of conception. So, if those retained products are not evacuated, it now becomes septic. So when it becomes septic, depending with the extent and how fast they come to the facility, they can evacuate the retained products and be possibly put on antibiotics. There are high chances of uterine perforation. So, like Victoria said, some use cassava stems. So you find that, and some actually use wires. So they insert in the uterus and try to like poke. So while they're doing that, you find that maybe they have a uterine perforation. And if that is not even noticed soon, they bleed and could possibly die due to excess bleeding. So unsafe abortion has a lot of consequences. And in my personal experience, when I was a student, when I was working from the gyne ward, I saw a young lady who attempted to abort on her own. So she hid the truth from her mom. So after the mom noticed that she wasn't feeling well, brought her to the hospital. So unfortunately, it was very bad that even on the abdomen, like she started, wait, what word can I use? Like rotting. So we could even now start seeing how that, because the situation was very bad. She wasn't really truthful about what really happened. So people could even actually lose their uterus in the process and never even have children in future. So unsafe abortions should be avoided at all costs.
All right. I see that George has dropped off. Victoria, any comments on the consequences of unsafe abortion?
I think, yeah, Anna has highlighted uh, the broader picture of the consequences, or rather the complications of unsafe abortion. So she has mentioned loss of the womb, like a person can lose the womb due to the type of practice that they've done. Uh, Imagine you get a wire, a wire or cassava leaves, and then you start poking yourself in the uterus, like through your cervix. Then you're poking yourself. So imagine what that is doing to your body or to your health, like to your system. So in that, you find you've perforated some of the things that are not supposed to be perforated. So you can find that you have sepsis, like your whole body, you have infection within your body, which can also lead, like if it is not treated, it can also result to death. So somebody can lose their life when they uh, do these unsafe abortions, or what else, like you can also, like she's mentioned a lot, you can lose, you can never become a mother again, you can never conceive, you have infection, you might even like cause internal injury to your body. I think, yeah, those are the major consequences that one can face when they go down the road of unsafe abortion. But when, if you have, like, in a case where a person has, like, you were raped, you want to have an abortion, you go for an abortion, like Anna had mentioned, the comprehensive abortion care has a, like, comes with a package where you are given information, you are um, advised. You are also given the option of contraceptive, so that in as much as you are sexually active, you do not want to have or have become pregnant, you can use family planning methods so that you're able to skip the part where when you become when you have an unplanned pregnancy, and then you have to undergo all those um, issues of going to conduct an unsafe abortion. But if you want to access safe abortion, you can go to the health facilities. We've already mentioned where you can access it for free. If the facility does not have the drugs to give you, they can refer you to the other facility that has. Thank you.
Thank you so much. And just to also make a comment in how it's so sad to see young people be the ones that are increasing the maternal mortality and morbidity due to safe abortions. I feel it's very important for us to take it up to ourselves to also equally spread the word to our fellow young people and not assume that the person seated next to us knows as much as we have. Share the information that you have. Thank you so much for joining us on today's show. I feel like this topic definitely deserves a part 2 because it's very interesting and it's very insightful and educative to our online audience. Thank you so much for joining us today. Catch you next week.
Thank you.